panning the room.
Hi, Miss Mannequin. My name is Sarah. I'm going to be changing the dressing on your central line and just changing the little caps on your lumen. Is that okay with you? Yes? Okay. I'm going to verify my orders and verify my patient. Can you give me your name and date of birth? Miss Mannequin 4971. Okay. I'm going to perform hand hygiene. I'm going to assess my patient for any pain, any I'm going to ask her about her allergies, if she has any allergies to anything. She says she has none. I'm going to stop anything that is infusing via the IV, but she has all the caps on hers, so she doesn't have anything infusing right now, so she's good. My bed is at an appropriate working height already, and my patient is already masked, and I've already instructed her to turn her face away, turn her head away whenever I'm working on her CVAD. So she's going to do that for me. And I'm going to keep in mind my general principles and safety practices. And I'm also going to wear a mask, but I have one right here, but for this video I'm going to leave it off because she won't be able to hear me. So, okay. I'm going to go ahead and perform hand hygiene again and apply some gloves. Make sure all the lumens are clamped, and they are. I'm going to go ahead and assess the site, assess for any redness, irritation, swelling, and I'm going to palpate and assess for any pain. And she said there's no pain, so she's doing okay. Gonna see if she has any questions or concerns, and she doesn't, so she's good to go. So I'm gonna go ahead and just lower her gown a little bit so that I can get to the dressing, so I can remove it. I can see through the dressing. I see that she has two sutures. I'm sorry. And I did read in her doctor's notes that she had 2 sutures, so that's good. She has 1 on each side, which is what I see, so that's good. So I'm gonna go ahead and remove this old dressing for her. I'm gonna stabilize the hub of her catheter, the big blue part of that suture, just to make sure nothing moves, anything like that. Just gonna be really easy about getting this tegaderm off. So once I've got it about off, I'm gonna pull it off towards the insertion site just to prevent from pulling on the catheter itself. So now that I've got that off, I'm just gonna ball it up in my hand and dispose of these gloves. So my trash can is down there. I'm gonna perform some hand hygiene. And yeah, so I'm just gonna go ahead and move this since I'm not wearing it right now. Perform hand hygiene, and I'm gonna go ahead and open my sterile kit very carefully. Okay, and perform hand hygiene once more because you never have enough. So I'm gonna open my sterile gloves, make sure my hands are good and dry because I have sweaty hands. So my patient has a central line that's right where about where her clavicle is, but if she had a PICC line, I would make sure that her arm is extended and above the level of her heart, below the level of her heart. I'm sorry about that. Mixed my words up, but so I'm gonna go ahead and apply my sterile gloves. I'm gonna fix that since I'm sterile. And okay, I'll go ahead and move that off. Alrighty, I'm sterile now, so I can touch anything in this box. So I'm just gonna slide it over a little bit just so I can reach it better. So first thing we would do to clean, we'd use a alcohol pad or just antibacterial pad just to make sure that we get any dry blood, any drainage, anything off. I'm gonna go in a circle about 2 to 3 inch in diameter, circumference, yeah. So just a 2 or 3 inch area, just making sure that any of that is gone. So I'm gonna go ahead and dispose of that, just very gently. And then I'm gonna allow that to dry according to facility policy. I'm gonna use my chlor prep. I'm gonna do a gentle back and forth motion, 2 to 3 area again, just making sure that I'm gonna allow it to dry, but I'm gonna just make sure it's all good and clean. I'm gonna allow it to dry according to facility policy. Also, if my patient had any topical anesthetic ordered or anything like that, I'd make sure that I'd given it enough time to work. She didn't have anything ordered. She was fine with it. So anything like that, we're good. So yeah, so I've already cleaned my area. My sutures, I can see those, they're good. So I'm gonna go ahead and I'm gonna apply. I've given my chlor prep time to dry and everything. I'm gonna make sure that her skin is protected, so I'm just gonna go around the insertion site, not on it, just to make sure that her skin is protected and everything. So that's good. I'm gonna give that time to dry according to facility policy. And yeah, so I've got a good tegaderm here. It's a big one, so. But before I apply this tegaderm, I'm gonna initial it, date, and time it, just to make sure they know who did it. But, so, my trash is down there. But I'm just gonna center this, make sure it's all good and clean, and apply that on. Once that's applied, I'm just gonna press down a little bit just to make sure it's applied. And this is a CHG, like, impregnated tegaderm, so it keeps it pretty clean and good, antimicrobial, all that, all the good stuff. So we're good on that point. So I'm just gonna remove this outer border and just make sure it's sealed along the way. All right, and that is good and on there. So, and if my facility had indicated a need for those little antimicrobial discs, I would have used one of those as well, but my facility doesn't indicate it. It just makes sure that we have one of those good old CHG tegaderms on there, and we're good. So she's doing all right. So I'm gonna go ahead, and I don't need to be sterile anymore. So all of her lumens are clamped, but so I'm just gonna go ahead and, I'm sorry, I wouldn't do that, but my glasses were on my nose. So I'm gonna go ahead and, before I do that, I'm gonna go ahead and get this ready. So I've got my new needleless connector. That's really hard to say, but I've got my new needleless connector ready to go. I'm gonna go ahead and prime it and get it ready to be applied. So I'm gonna go ahead and prime it, and it's primed and ready to go for me. So I've got that, and I've got just an alcohol prep pad. So I'm gonna remove this old one. I'm gonna scrub the hub vigorously. I'm gonna allow it to dry according to facility policy. That was trash, I'm sorry, that's trash. So I'm ready to install this now. I've already scrubbed the hub, so it's good and clean. So I've got that installed. I'm gonna unclamp my lumen. I'm going to aspirate, and I'm looking for blood return in the tubing, but no blood return in the syringe. I don't want any blood in the syringe. So I've aspirated, the line is patent, I get good blood return. I'm gonna do a pulsatile flush with a 10 milliliter syringe. And I'm just gonna do 1 milliliter at a time over a minute. So pulsatile flushing, and I've done that, so I can go ahead and remove my syringe and dispose of it. Just to be sure, I'm just gonna go ahead and clean this again, since I'm gonna be putting a passive disinfectant cap on it, a Kuros cap. But just to be sure, we like to make sure everything's clean here. So actually, before I would apply that, so act like I didn't do that, I'm sorry. So I'm gonna clean this again. And the doctor has ordered a heparin lock solution, a locking solution. So I'm just gonna go ahead and administer that. So I just cleaned my hub, it's ready to go. So I'm gonna instill the locking solution, 1 milliliter pulsatile flushing, over a minute, or as ordered, as indicated by the facility policy, I'm sorry. So, I've already done that. I aspirated previously, and I know the line's patent, so I don't have to aspirate it again. So, I did that. The heparin solution has been instilled. It's locked. I'm going to go ahead and clamp my lumen. I'm sorry. Now I would apply my passive disinfection cap. Or I'm sorry, I would scrub it first. I'm going to scrub my hub again, just, for sanity's sake. I'm going to apply my passive disinfection cap. And I would repeat this process for the other 2 lumens or however many there are. I'm going to assess my patient, ask if she's having any pain, anything like that. And she said she's good. She doesn't have any questions or anything. She tolerated the procedure very well. I'm going to clean up my mess, just make sure it's all cleaned up. I'll remove my gloves, perform hand hygiene, and record and document.